I want to ask you both a question that relates to both healthcare and the COVID-19 pandemic. Rather than criticizing the past response, there will be plenty of time for that in the general election. I would like you both to look forward at how you believe that Congress could strengthen Americans' healthcare system to prepare for the next pandemic or the next wave of COVID-19. Mr. Hickenlooper?
Well, obviously, our preparations were woefully inadequate. And I'm not just talking about President Trump and even Cory Gardner poo-pooing this as not going to be a real pandemic or a real threat. We need to build up our public health infrastructure and make sure that we have the preparations for any kind of a pandemic or any kind of a serious natural disaster in any of the related health fields. Part of that means that we've got to go back to the Center for Disease Control, which President Trump reduced their funding. Cory Gardner supported that. But we also have to make sure that our hospitals across the country have adequate supplies and have ready supply chains for PPE, and to make sure that there are supply chains for testing if we get another pandemic. We need to be prepared for whatever comes forward. And we also have to look at the environmental degradation that Trump, by rolling back the EPA regulations that took decades to put in place, is making the environment around us inherently less safe.
Thank you very much for sticking to time. I understand that's a challenge in this format, and both of you guys are doing a good job with that. Mr. Romanoff, can I ask you, what does Congress need to be doing now to prepare for the next pandemic or the next wave of coronavirus?
We need to adopt a system of Medicare for all, strengthening Medicare by adding benefits for dental and vision and hearing and long-term care, including mental health and substance use treatment, which are even more important now than ever, and then lower the age of Medicare eligibility to 0. This is a place where I differ not only with Cory Gardner, who has voted repeatedly to repeal the Affordable Care Act, but also with John Hickenlooper, who compares plans like this to the work of Karl Marx or Joseph Stalin. I wonder what John would say about Medicare itself. Parroting the talking points of the insurance industry or the Republicans is not going to get us the system we need. And I don't know what you tell John, what you would say to the 500,000 families who are going bankrupt each year because they can't afford their medical bills, or the 72 million Americans who are uninsured or underinsured even before the pandemic hit. Your offer of evolution is pretty cold comfort to families in those circumstances.
Mr. Hickenlooper, I would like
Andrew,
to have you respond to what Mr. Romanoff just said, because I know you guys have a difference of opinion, but I want to ask you a direct question to start off this answer, if you would, and then please respond to him. Mr. Hickenlooper, if Democrats take the White House and the Senate, they would be in a position to pass Medicare for all, which Mr. Romanoff supports, and it's something that you oppose. If it came to that, would you vote with Senate Republicans to block Medicare for all?
I have said for a long time that I believe Obamacare is a great foundation on which to get to universal health care. Universal health care is a right, not a privilege. And I believe we need to build upon what Barack Obama created, and Andrew wants to repeal it. I think that if we're able to create a public option that is maybe some form of Medicare Advantage, maybe some parts of Medicaid in there, but a sliding scale public option that allows people to get their health care coverage, and no matter their circumstances. And then we look at how do we begin controlling the costs, letting our government for the first time negotiate bulk discounts in the purchase of prescription drugs for Medicare. That gives you a savings that helps you expand to universal coverage, but it also begins that move towards transparency and fairness that'll help Americans, in every walk of life, to be able to control the enormous increases that they've been having to put up with in terms of insurance and insurance premiums and prescription drugs.
All right. I understand that you guys could go on at some length about this, and you have in forums. I'll let that conversation continue elsewhere while we touch on other important topics.